our doctor, our in-house doctor. Obviously, I know I don't miss him so much, but he didn't leave you guys without information because for a lot of those days with Dr. Binofi Maker, we played the ones that we've heard before. That means it will be also give you opportunity just in case we miss and then to make sure say we did in line, at least we waiting the shell. It's so sad because we felt at a point, say we don't the conquer, we felt we could relax, we felt okay, fine. At least now we feel just, unwind a bit because okay, we don't reach that level of conquering. But all of a sudden, the second wave just come out and it come like say even big pass the first experience we'll be getting. Talking about the pandemic, talking about coronavirus. I talk about waiting they affect the entire world because nobody's spared right about now. Now disease we say no sabi poor, no sabi rich, no sabi young, no sabi old. Is actually a respecter of no one. Ladies and gentlemen, they call me the slimmest of them all. And like you all know, now the number one family entertainment channel. It's a Saturday, and obviously the Health Matta segment. Now we can't put doctor is in the building.
Slimmest of them.
Always prepare for
Slimmest of them. I'm seeing you for the first time
this year. Yeah, that's true. Happy New Year, doctor.
Yeah, the same to you.
I'm not just happy, but it's fine.
I know what? Yesterday was my birthday. Hopefully we'll be able to cut the cake.
Yeah, so we have to. Oh, doctor.
Later in the day.
Happy birthday to you. Sir.
Yeah, thank you very much. Good morning, viewers at home and around the world. We are happy to be back this year on Health Matta.
Yes, so thank God.
Okay, this is our first episode in the new year. So I want to say a very big Happy New Year to you all.
Yes, sir.
Wherever you may be. Okay, so this morning we'll be talking about COVID-19 pandemic, coronavirus pandemic. We'll be looking at updates with respect to what she has spoken about, the second wave, vaccines, where are we at the moment? What hope do we have for Africa? And of course, our own dear country, Nigeria. Are we making progress? Are we about to get our own doses anytime soon? These and many more we'll hear in the course of the program. But first, I want to start with letting us know where we are globally. At the moment, the caseload on a global level stands at 89,356,726. This number of individuals have been infected since the onset of this pandemic. And of course, the deaths that have occurred so far are almost getting to 2 million. 1,922,100 individuals, 100 human beings have lost their lives, unfortunately, to this COVID-19 pandemic, and people are still dying. Just 2 days ago, America witnessed what happened to be the deadliest day they've seen with respect to COVID-19. Over 4,000 human beings died in the US. I'm not talking about new infections. I'm talking about people that lost their lives. This is monumental crisis that is affecting the whole of humanity. Of course, Africa and Nigeria are equally not spared. Okay? So at the moment, US, for instance, US at the moment has a caseload of 22,456,902. India, of course, comes second. In the last 24 hours, US have recorded 301,655 new cases. 300,000 cases in one day. As a matter of fact, the last statistics that was released about a fortnight ago said that a human being dies in the US every 33 seconds. A human being dies in the US. And of course, with the increase, we expect that to be much lower now, much worse than it was a fortnight ago. India, of course, comes second with over 10 million infected people. Brazil is at the number 3 position with over 8 million infected persons. UK, Russia is number 4th with over 3 million infected humans. And of course, UK is almost getting to 3 million. Let's look at Africa. South Africa has gone past the green milestone of 1 million infected persons. It's a green milestone. It's not a good one. It's not a good record. They have joined the league of countries that have caseloads of COVID-19 or coronavirus at the north side of 1 million. That's not good enough. And the new cases that were recorded in South Africa in the last 24 hours was 21,980. The number of people that died in South Africa in the last 24 hours is 616 persons. After South Africa on the list comes Morocco with 450,221 persons infected in that country. Suffice also to say that some of these infected people, a good number of them have actually recovered. Okay, so globally, at the moment, 64,009,522 persons have been able to recover from this deadly scourge. Still on Africa, Ethiopia, Tunisia is on number 3, Egypt 4th, Ethiopia 5th, Libya 6th, and of course our own dear country Nigeria stands at number 9th position. And so far, in total, Nigeria has recorded 97,478 infection rates or infected persons. I beg your pardon.
Gradually coming to 100.
Yes. And of course, in the last 24 hours, Nigeria has recorded 1,554 cases. And the total deaths so far in Nigeria, yes, we have that on our screen, is 1,342 persons have actually died. And of course, these are recorded cases. What about people that died without getting tested? Your guess is as good as mine. From 29th of December till now, I was trying to do the summation earlier in the day. 85 persons documented have died in Nigeria. And in the last 24 hours, 12 persons have died in Nigeria. We've never had it so bad. Not even at the time we were at the peak, early on in April or thereabout. Okay, so Nigeria is seeing the worst case that we've ever seen since the inception of this pandemic. And that's, of course, is the reason why we are here today. To tell you that if you're seated there and you think COVID-19 is over,
it's just starting as it is now. With the figures we are having,
it has just started. And that is why we need to go back to those things that we started doing early on in the pandemic. Ironically, when we were at the peak, when it wasn't this bad, people were a lot more conscious. A lot of people were adhering strictly to the COVID-19 guidelines. A lot of people were obeying public health measures. A lot of people were putting on face masks when they're in public places. They were washing their hands. They were equally sanitizing. But we're beginning to see a drop in our guard. And of course, we can understand. I must also appreciate the fact that we felt this was going to come and go in the year 2020. But alas, it has dragged on into yet another year. Of course, it didn't start in 2020. It started in 2019
December.
Yes, that's why the name COVID-19 is there. Okay? And here we are in 2020. We are starting again with these unfortunate statistics. It is no longer news that we have vaccines at the moment. But the truth of the matter is that there are a number of challenges. The vaccines that are currently being produced can actually not be enough. People are queuing all over the world for this vaccine. And I want to tell you today that Nigeria will be expecting her own stockpile of vaccine.
Stockpile. The way you are saying, I feel that they are giving us millions.
Doses. Well, of course, it's something. We're expecting 100,000 doses by the end of this month. We were told so by no less a person than our own Dr. Faisal. Shuaibu, who is the Executive Director of National Primary Health Development Authority, Development Agency, MPHCDA. Okay, so he has said that before the end of January, Nigeria will take delivery of 100,000 doses, of about 100,000 doses of BioNTech, Pfizer-BioNTech brand of vaccine candidate. Of course, that appears to be the number one, okay, all over the world at the moment. And later in the year, we'll be expecting about 40 million doses that will be coming courtesy of COVAX. COVAX is a program that is being put together by Gavi Vaccine Foundation, and it is being co-shared by WHO. Okay, so that is good news. Also, I want to point out that a number of Nigerian governors have agreed to take their own vaccines on live television. Ditto for the presidency, just like we saw.
They did in America.
Yes, in America. Now, why are they doing so? There appears to be a lot of apathy towards this vaccine. People are asking a number of questions. Is it going to be safe? Is it not a vaccine that somebody will take, and at the end of the day, children that probably take it will start becoming impotent? No, that is not going to be the case. As a matter of fact, the two leading vaccine candidates are the type of vaccines that we have never seen before now. They are called genetic vaccines, messenger RNA vaccines. I'm talking about Pfizer-BioNTech vaccine as well as Moderna vaccine candidate. Okay, these are the two leading vaccine candidates. Just to give us an overview, okay, coronavirus vaccine tracker. At the moment, 43 vaccine candidates are in phase 1 undergoing clinical trials. 20 are in phase 2. The update is as of yesterday, the 8th of January, 2021. 20 vaccine candidates are undergoing large-scale efficacy trials. We call that phase 3. About 7 of these vaccine candidates on a global scale have achieved limited use authorization. Only 3 have achieved approval or have been approved. And just recently, WHO has listed Pfizer-BioNTech vaccine. Okay, so any moment from now, they probably will receive a validation from WHO. And of course, that is some good news.
Talking about the caseload now globally, we don't enter 89,353,000 and of course 726. In talks say globally, America the lead, followed by India, followed by Russia, followed by Brazil, said no carry last, and of course UK. And I know say UK right now, then they're on lockdown.
Yes.
Because their prime minister have been talking, say if they continue like this, it's like every part of the person, everybody where they inside UK go they affected. And of course, bringing it to Africa, we get South Africa leading, and of course Nigeria being on the ninth on the table, rather, which is very, very sad, doctor, because the truth is I feel with a try. Okay, let me just ask you now in all sincerity, doctor, as a doctor, do you think we are doing enough as citizens?
Yeah, we are doing enough. I must commend the efforts of Nigerian authorities. Before now, because why am I saying so? At the beginning, we can all understand and appreciate that we started from a scratch. Unlike South Africa, that had a very strong healthcare base. Or even at that, they were not spared. Okay? So at the beginning of the pandemic, we had about 2 to 3 molecular labs that had the capacity to test for the COVID-19. But as we speak, we are nearing 100, if we haven't gone more than that. And I also would like to point out, because I was among the people that gave them a lot of knocks at the beginning when we weren't testing a lot, when other countries around us were far ahead of us, but not anymore. Nigeria has gone above 1 million mark. Okay. So we have tested over 1 million. Okay. And still counting. All right. A number of countries around us that were above us, not anymore. Ghana, I think, is behind us now. But we are not relenting. We shouldn't relent in our efforts. Okay. Now, the pandemic is hitting hard is hitting every country of the world harder by the day. It's not just Nigeria. So Nigeria is not spared.
We are not left out.
Yes, we are not left out.
Okay, now you've spoken so well for the government, and these days I get to see people on their marks, trying to social distance themselves. Like, okay, we no longer have parties and all of that. So now, speaking for the citizens, Doctor, because you get to meet these persons every day, do you think they are doing enough, or do you think they say they give this "I don't care" attitude to the pandemic?
I must be very honest with you. Thank you for that question. I will tell you the way I feel about it. I think a typical Nigerian, okay, ordinarily will be reluctant, let me use that word, to do what is expected of us. But when you have government agencies trying to enforce that, only very few Nigerians will ordinarily take to public health measures in accordance with what government has said. But a majority of us will still need to be enforced to do the right thing. Okay, so that is why government agencies need to step up their game. Okay, I want to see a situation where they will issue ultimatum to visit supermarkets, visit organizations that have not put the hand washing facilities in place, just like they were doing back in the days to some filling stations that were hoarding fuel in the period of scarcity. Some places were closed down, others learned their lessons, and of course everybody had to sit up. We want to see such things happening in a number of organizations where people are coming crowded without face mask, because that is the only way we can help ourselves. Of course, we all know that Lagos is the epicenter of this COVID-19 pandemic. I think the highest we have seen in Lagos is we're testing over, we're recording over 800 cases in Lagos now. So there might come a time when Lagos may be counting in thousands if urgent measures are not put in place. So I want to see government enforce these COVID-19 rules. Okay, I want to see them do more than they're currently doing. Okay. That is what I feel about it as a person.
Okay. So, Doctor, I don't know, there is this update or there is this gist you are hearing on coronavirus variants.
Yeah, you're correct.
And now it's so scary because they talk say don't do Nigeria. First off, I don't know what that means. Okay, so what does it mean? Is it another type of coronavirus? Or?
Yeah, now thank you very much for that question. New COVID-19 variants, what does that mean? Now, let me start by saying that the variants are not unexpected. Now, I will explain what I mean by that. Viruses usually undergo mutations. They change their form. Okay. Now, let me give you an example of what mutation is all about. You may see a virus, and today the virus is putting on a blue-colored face mask. Tomorrow, it may be putting on a black face mask. Okay, so that is what a good example of what mutation is all about. The virus that you have always known that, come on, it comes out only with red face mask, and the next day you're seeing another one putting on white face mask, and the third day you're seeing yet another one putting on a blue or black colored face mask. That is what mutations is all about. So presently, now this virus that get mutated over time, some of them may even make the virus a lot harmless, while some may make them a lot deadlier or more virulent. Talking about the pathogenicity of the virus itself, okay? But at the moment, what we have now is that the variants that are currently circulating globally, we now have some newer variants, okay? One was the one that was discovered in South Africa that has been found to be a lot more transmissible than the ones we have seen before. Don't forget, coronaviruses are a large family of viruses, okay? COVID-19 has a number of variants, and a good number of them are beginning to undergo mutation. And they are beginning to, the worry is this.
So let's take Mrs. Florence from Canada. Good morning, ma. Mrs. Florence. Hello, Mrs. Florence. Okay, she's gone. Okay, so please, I think, yes, officially, let's open our lines. If you get questions, you get contributions, anything really confusing to you about coronavirus and, of course, the update on vaccine, please feel free to call the numbers on your screen, 081731475 089 and of course 08105434984. Right, sir?
Yeah, thank you very much. Now, the first variant was discovered in the UK. I think it was sometime in September 2020. Okay, and of course, we all know what is going on now. They are currently on a lockdown. Now, some parts of London and southeast England have been affected badly by this new variant. Now, these new variants are a lot more contagious than the other variants that have been circulating globally. And people are worried with this new vaccine that are currently out be able to offer immunity against these variants that we are seeing. And of course, there is an area of hope that came out, I think, on Thursday, a study that was done in the US by the team of Pfizer-BioNTech, pharmaceutical giant. They've been able to test some of these variants, and they discovered that the Pfizer-BioNTech vaccine can equally cover against this new variant. So that is a good news.
That's good.
Okay, that's a good news. Now, the other second variant that has been found out is circulating globally was discovered in South Africa sometime in October. And of course, there's a variant. CDC has said that the variant has equally been found in Nigeria. Okay, but they don't yet know whether the Nigerian one will be just like the two that we've talked about, the one from South Africa, and of course the one from London. From UK, England. Now, a number of countries are avoiding getting those variants because, of course, they will increase the number of because of the transmissibility of such variants. They're a lot more contagious. So, as a result of that, they are placing travel bans. A number of countries have placed ban on South African people coming from South Africa to such places. Ditto for UK, they are not spared because of these variants. And of course, it is a common knowledge that they've gone back into a lockdown. So it's actually a frightening dimension, but we are not resting. The whole of humanity are trying to contain these new variants.
Okay.
All
right. Okay, so Doctor, one of the videos I watched, I saw, I think it was the first person that spoke. He actually mentioned
Professor
something.
Oyewale
he talked about infections not becoming a disease. First off, that's quite confusing to me. And then secondly, now, what is the essence of the vaccine? Is it that it prevents you from being infected, or I don't know, if you take it, can you still come down with the virus?
Yeah, those are very good questions. Okay, let me also use this opportunity now that you have called my attention to it to pay homage to our own renowned virologist, Professor Oyewale Tomori. Okay, now he has said in that video that if the vaccine gets to Nigeria, he will be among the first. He will invite his family to come and take, and he will also invite you and I. I like that. Okay, now that is people who should know. Okay, when you're talking about virus, the field of medicine that specialize in virus and viruses, that are called virologists. So that is a guru in the field, telling us that this vaccine is safe. Okay, telling us that if he comes into Nigeria today, he will offer himself. Okay?
And his family members.
And also will invite us. And I would also like to ask you at this juncture, will you take if he gets to Nigeria?
Yes, definitely.
I know that question will come to me, so let me start with you.
No, funny enough, Doctor, I would take, and that is why I'm trying to make sure I understand every bit of what the vaccine
No, I didn't get that. You said definitely you would.
I would. I would take.
I like that.
But then I need to know what I'm taking. So because why I've been asked you about that question of, okay, does it prevent me now from being infected? There was a video of him, a doctor, where been take the virus. Had the vaccine a week ago, and then he came down with the virus. So I don't know, how does it relate? If I'm taking it, I think it's supposed to prevent me. So if it doesn't prevent me, why am I taking the virus?
Yeah, thank you very much. Let me take you from the second part of your question. Now, when Prof was talking, we have Emmanuel from Benue. Good morning, Mr. Emmanuel.
Oh, what's wrong with the line?
Sorry about that. We'll be able to get you. Now, when Prof was talking, he said something that even after taking the vaccine, he still advised anybody who has taken and probably completed the 2 vaccine doses. Most of them are coming in 2 shots. We'll talk about that shortly. That such people should still go ahead and observe public health measures, ensure that they wear their mask once they're in public. Okay, that's Prof on our screen now. Ensure that they wear their mask once in public. Now, to answer your question, does the vaccine prevent one from picking the infection? The current vaccines that are available, none of them can do that. However, I need to make a clarification here. Some diseases are vaccine preventable, others are not. A good example of a disease that is vaccine preventable is hepatitis B. It's vaccine preventable. If you take a shot, if you take the vaccine, you're not likely to pick it in your lifetime.
Okay.
Another another disease that is vaccine preventable, of course, is cervical cancer. Okay, and a whole lot of other. Now there are some that when you take, you may still have the infection at the end of the day. So such vaccines will not give you a lifelong immunity. Now, this newest vaccine candidate, talking about the messenger RNA vaccine candidate, are new. The humanity have not had a vaccine in that category. So they are newer vaccines. That accounts for the reason why people who have had the disease, for instance,
let's take Abraham from Plateau. Disconnect. Hello, Abraham. Good morning.
Hello. Good morning.
Good morning. Good to have you on the show.
Thank you very much.
All right, please go on with your question.
Actually, there are some things that you have to understand here. This COVID-19 issue. We have different educated people, most especially students. Why not if you make use of them? Like now, we have pharmacists, we have doctors, most people drugs from outside countries. Mostly, let us make use of what we have. What we have that is available, we should make use of it. Imagine go to outside country. Now the doctor is saying that just thousands. And we have almost 160 million people in Nigeria. We have to make use of what we have that is available now. Because Nigeria is the country that we don't value what we have. We don't value what we have. We should value what we have. Now, let us come to University of Jos now. We have students that are very good. Very, very good. Every students are good. Even pharmacologists, they are very good. But we must go to outside country. Must we go to outside country before we bring in drugs?
Okay, let me see if the doctor has an answer. Doctor, he said must we go out to...
Yeah, he is making a lot of sense there. But in Nigeria, I must also acknowledge that we have not folded our hands. Okay, I think Nigeria is also working on a number of vaccine candidates. Any moment from now, we'll be getting our own updates. Okay, apart from working on vaccine candidates, we've said it countless number of times here that Nigeria was among the nations of the world that carried out...
In Nigeria?
Yes. No, I'm not talking about the doctor that was among the...
Nigeria itself?
Yeah, Nigeria itself.
Really?
Yes, we were part of the WHO mega drug trial that looked at chloroquine and hydroxychloroquine and a number of other drugs. Okay, so... We're actually trying to do our best, but of course, he has made his point. We should look inwards.
We need to start fancying
see if we can get a homegrown solution. We must not always be looking to import what other people have made. I think that is his point.
Okay, so Doctor, are you done with the explanation of vaccine?
No, I'm not done with the explanation of what you asked. It's very important because Prof on that video clip actually said that people can pick the infection, someone can pick infection and may not have the disease. That is the aspect to say that you got confused. Now, the difference is this. Now, for instance, people take flu jabs, flu vaccines in US on yearly basis. Okay? Now, this vaccine will enable your system to ward off the infection when you eventually get infected. What it means is that if you take COVID-19 vaccine today, and of course in 2 weeks' time, if you're taking the Pfizer-BioNTech shot vaccine candidate, in 3 weeks' time, you complete the 2 shots. You can still pick COVID-19 infection, but you will not end up with severe disease. Let's talk to Felicia from Abuja.
Good morning.
Good morning there. How are you doing?
Fine, thank you.
All right, please go on.
I want to know about this coronavirus vaccine.
What do you want to know in particular?
Because some people are on health conditions.
Okay, so is it for
High
everybody?
blood pressure. Some people are on drugs.
Okay.
Yes.
So I want to know if this vaccine, it will affect their health or not.
Okay.
Yes. Thank you
So
very
in
much for that.
summary, is it for
Yes.
everybody?
The vaccine candidates have some specifications in terms of the dosaging, in terms of the age group of people that are expected to have the shots. Okay, I must tell you that the first person that got the shot in the UK was an 81-year-old man, William Shakespeare by name. Of course, he got that jab. UK was the first to actually give approval for Pfizer-BioNTech vaccine. They did that on the 2nd of December, if I'm not mistaken. And by 3rd of December, they've rolled out the vaccine. And one of the very first person that got the jab was an 81-year-old man. Now, why am I bringing this up? I'm looking at the age, okay? Some of the vaccine candidates will only cover some certain range because that actually where the trials were. That age gap or age bracket probably was what the trials were centered on. The vaccine trial were centered on. So at the moment, we don't have vaccine that can be taken by anybody that is less than 12 years of age. Now, to answer her question specifically, people who have diabetes, who have other comorbidities like hypertension, can actually take this vaccine. People who have had COVID and survived, for instance, Mike Pence in the US, the vice president, the current vice president actually picked up the infection along the line and survived. We've seen him on live TV taking the vaccine. Okay, that is why I say that this vaccine candidate is different. The messenger RNA vaccine is different from some other vaccines that have been in existence before now. The earliest that we have had a vaccine coming out on a record time before now was actually the vaccine for mumps that came out within a space of 4 years. Ordinarily, it takes a whole lot of years for vaccine to be produced. Okay, but this year we saw medical magic in quotes now. So we've been able to get vaccines within a year of fighting the pandemic. And thankfully, those vaccines are way 90% and above in terms of efficacious rate. They're very high. They came out with very high efficacious rate. But the challenge we're having now is that the vaccines are not meeting up. For instance, US, for instance, gave an estimate that about 20 million persons would have been immunized, inoculated or vaccinated before the end of last year. Okay, but overall, they were able to do that for 4 million people. So the world is practically running behind schedule with respect to vaccination. 250 million Nigerians, what is coming our way by the end of January? Of course, we are told that we'll be expecting 100,000 doses. How far can that go? Of course, they need to prioritize so that it could go to healthcare workers and then leaders. Okay?
Before it will now come to people like us. It's okay. We are waiting. We anticipate.
If one picks the infection, you may not end up having the disease. That is if you have a strong, robust immunity, which of course we expect this vaccine to provide. And that is why it's important that we should all embrace it. It's safe. If it gets to Nigeria, I will also take my own, if possible, on live TV, maybe on Health Matta Studio, so that people will know that it is safe, okay? Just like Slimit pointed out that she will also avail herself. I will invite my family members, invite my staff and management of my facility, and all the members of my community, and of course, Rotary Club members. I must also point that out. Okay, so what we do not know now about the variants, okay, is number one, how widely these new variants have spread. Okay, which countries of the world do we have them at the moment?
Outside Nigeria, that you mentioned, outside South Africa. And
how the new variants differ from each other. With the vaccine that is correct, that the vaccine that are currently out will also offer protection against these new variants. That is what we do not know for now, but a lot of research are ongoing. And thankfully, like I said before we went on that break, that just on Thursday, Pfizer-BioNTech came out to say that they've done some trials in the lab, and their COVID-19 vaccine candidate can actually cover against the UK and South African variants. That is making people to lock up ban travels between these countries that have been affected or are suspected to have or to harbor these variants. Why are they afraid? Because of the highly contagious nature of these new variants. They have been found to be a lot more contagious than the pre-existing variants that have been in circulation, about 30 to 60 times much more contagious than the previous ones that we have seen before now. And I also would like to point out that in terms of the second wave, it is really hitting hard on Nigerians. In the last 24 hours, 12 people were reported to have died of COVID-19. I'm not sure if we have had it this high since the pandemic started. And I can tell you that from 29th of December 2020 till now, it's only on 2 days that we have had figures below 1,000. And of course, that was on the 2nd and 3rd of January. Okay, so from all the other daily updates that we are getting have been over 1,000. Okay, and I think 2 days ago we saw what should be Nigeria's highest so far. Yes, that was 2 days ago. 1,664 new cases.
That's almost 2,000.
Yes, were discovered. You can see we are going through them on our screen. 917
on January 3rd.
On January 3rd.
Okay.
1,204 on the 4th of December.
January.
Yeah, 4th of January, I beg your pardon. 1,354.
And on the 5th, we had 6th, we had
1,664.
Wow.
And of course, 1,565 new cases.
The numbers are increasing.
And of course, we have said that before, Lagos is the epicenter in Nigeria.
1,544.
Yes.
Now today, we don't know what we are coming up with.
And that is the reason why we need to step up our guards. So if you have dropped your face mask, if you think it is all over, please do. Even when the vaccine gets to Nigeria, even when we get vaccinated, we still need to put on the face mask, because with vaccine, you can still catch the infection. The only difference is that you're not likely to have a severe outcome. It's not likely to be a severe disease. Okay, so it will just be like somebody getting malaria and, of course, taking 1 or 2 drugs and getting cured over a space of few days. Okay, so that is what the vaccine can do.
By the way, is it going to be free, doctor, or we have to pay for it? No, because that's another fear. You know it is. We need to know, are we paying so that we'll get ready, or it's going to be a free one?
As a matter of fact, from what I've seen with other countries of the world, I think Nigeria will also queue alongside other countries of the world. All the places where the vaccines have been rolled out, that they've been made free, okay, to their citizens. And also, the 100,000 doses that are coming after that, we're expecting another 40 million doses. Okay, that will go a long way. Courtesy of COVAX. COVAX is being co-chaired by Gavi Vaccine Foundation with WHO. Okay, hopefully, but when that shows up,
I think that is when our own tongue
yes, because this 100,000 will be restricted to frontline health workers.
Yeah, you guys need it, doctor. You guys are doing fantastic jobs.
And I can tell you that it will just be a drop in an ocean. Okay,
yeah, because you guys have many too.
So that is what we need to know about the vaccine. So, and
I think that is where we'll have to pause on the show today, because our time is fast spent. So definitely, doctor, you are going to continue next week Saturday. Yes. We are going to be on this for a very long time. So we're just starting because the numbers are increasing.
And you need to stay safe. You need to stay protected. Encourage people around you, your loved ones, the people who you work with, in whichever place you work.
Okay, yeah, so whichever place that with the doctor don't talk, do all you can to
avoid crowds as much as possible.
As much as you can. All right, so guys, remember to follow us on every of our social media platforms. On Twitter at WAP_TV, YouTube, we are WAP TV channel. On Instagram, WAP TV channel. On Facebook, WAP TV channel.
I will be with you next week.
Next week, Saturday. Happy birthday once again to our doctor.
Thank you very much.